Okay, everybody, let's talk about how to do a nephrectomy. We've already done our IHDR, so we have retracted. We can see our anatomy. I want to pay special attention to our anatomy real quick. We have our carotid fascia, which is covering our kidney. Our kidney is here. Our liver is down here. If you notice these vessels here that come off, we have a renal artery, a renal vein. There is a renal nerve that runs through here. All of this is called the pedicle of the kidney. So this is when we talk about a pedicle clamp, this is what we're going to clamp off. The renal artery comes right off of the aorta. So super close, super big artery. We want to be extra careful with this because one, we don't want to nick the aorta. And two, this is going to cause us a lot of blood loss if we don't get this fully ligated before we cut it. Renal artery renal vein drains right into the IVC, inferior vena cava. So we want to make sure also that we're paying attention to this part of the pedicle. We want to make sure we get it fully clamped when we clamp on it. If we look at our kidney, we also see our ureter coming off. The ureter, when it comes off, goes right along the abdominal wall down into the bladder. It's going to follow retroperitoneal, means it's outside the peritoneum, traveling down into the bladder. We have a very important structure up here on top of the kidney. This is your adrenal gland. We don't want to take this if we don't have to. So we want to try and leave our adrenal gland here. Carotid fascia covers all of the kidney and the adrenal gland. So we're going to have to make sure when we dissect off carotid fascia that we are leaving part of that there along with the adrenal gland. I don't have it on here because our kidney's awful small in our patient, but there is fatty pads all across the kidney. We want to make sure that we save those fatty pads on our back table or Mayo stand. Make sure that they're in some saline soaked 4x4s or Telfa, something like that to keep them nice and moist. We may need to re-implant them later on during the procedure. So, first thing we're going to do after we identify all of our anatomy is we are going to work on the ureter first. So the first thing we do is we clamp our ureter. I'm going to use pedicle clamps. We don't have to use pedicle clamps. We can use other kinds of clamps. We can just use peons if we want. I just happen to have pedicle clamps here on my Mayo stand. So that's what I'm going to use. We are going to clamp, and then we are going to doubly ligate. And we are going to use a non-absorbable suture because we don't want this suture to ever pop off of this structure here. So I've got tie on a pass around. Ooh, and I can't see because I gotta make sure my camera stays. Let's go this way. Okay, there we go. And if my head's in the way, I'm sorry, guys. Okay, tie on a pass. Got my first tie. Doubly ligate the ureter. So I'm going to go on one side of my clamp. Don't judge my tying techniques, they're horrible. I'm a surg tech, not a surgeon by trade, so please have some mercy with me. Ligate one side. All right, ligating the other side of the ureter. So now we have two ties on that ureter. Okay. Cut those. Now I have my two ties between my clamps. I am going to cut this ureter with my Metzenbaum scissors. them in the body, I can release. That stays inside. My clamp that is going with the kidney, I can release. Ureter's tied off. We're not leaking urine anywhere. And now I can start dissecting and freeing up this kidney. And so by freeing up this kidney, we're going to want to dissect down in here, and we're going to want to get this kidney free of all of its attachments as much as we can, while not disturbing the blood supply. So we free up from here the best we can. Then we are going to clamp again with our pedicle clamps. And notice our pedicle clamps are designed to go right around that kidney. That's why we have the shape that we do of those pedicle clamps, is because they're designed to go right around the kidney. So clamp, clamp. I've included the blood supply. Getting my tie on a pass, set up again, tie on a pass. Oh, and my artery. Okay, tie our vessels. We only need one tie up here next to the kidney. Because these are the parts that are leaving. When we say triply ligate the pedicle, it means one tie next to the kidney, two ties next to the aorta. Because we do not want any bleeding into the peritoneum, into the abdominal cavity, from our renal artery and vein. So we want to tie this twice on this side. There's our first tie. And our second tie. Also, why we want silk. We want to make sure that this never dissolves, never comes off. We want this to stay for the rest of the patient's life, making sure that this is tying tight that renal artery and vein that are coming right off of the aorta and the IVC, so that we don't have any bleeding. All right, now we take our Metzenbaum bomb scissors. We divide the pedicle. This part stays in the patient. We now continue our dissection, making sure that we leave Garota's fascia on the adrenal gland.